I'm going to be talking about some clinical trials that have found that treating patients with high risk or otherwise smoldering myeloma has shown benefit. So the first trial that was published in this space was in 2013 by Dr. Mateos, who's in Spain. And the trial was called COREDEX trial, which looked at induction treatment with Revlimid, followed Revlimid and dexamethasone, followed by Revlimid maintenance for 2 years in high-risk smoldering myeloma patients. We did find in this study that the time to progression for patients who did receive Len-Dex was 9.5 years, as compared to just 2.1 years in patients who were randomized to just observation. Similarly, we also found that the overall survival at the time of this analysis was not reached for patients with Revlimid dexamethasone and was 8.5 years for patients who underwent observation. While these results are very promising, I'd like to bring out some critique that we have for this paper. Firstly, it was published in 2013, wherein some of the newer criteria for diagnosis of multiple myeloma did not exist. And we do think that some of these smoldering myeloma patients enrolled in the trial actually would be treated like multiple myeloma patients if they were to be treated right now. Otherwise, also, the study did include high-risk smoldering multiple myeloma patients, but the classification was very varied and did not, really include the 2020 criteria that we have at this time. Another trial published later in 2020 was the SCHEMA trial, which was done by Dr. Loniel from Emory. And he essentially studied whether patients with smoldering multiple myeloma across all risk groups should be given lenalidomide versus observation. So in this trial as well, he found that the hazard ratio for treatment with lenalidomide versus observation was 0.28. And in a subset analysis of patients across different risk criteria based on the 2020 classification, the hazard ratio was 0.15 in high-risk patients and 0.5 in intermediate risk patients, again telling us that the major benefit of treating patients in smoldering myeloma has been seen in the high-risk population only.